going to talk about the use of psychological therapy along with narcotics medication and the benefits that it could possess. I want to address the addictive character of narcotic medications and the role that psychological therapy can play in solving this issue. Wise states, one should not use temporary solutions for permanent challenges, and neither should they apply permanent solutions in addressing temporary problems. Sometimes we must troubleshoot. Small doses of narcotics can have very valuable effects in the medical community. Some effects could be relieving pain, reducing anxiety, and they find that, however, it is the addictive nature of narcotics that I want to address today, and I want to see reduced. It is very futile that depression, relationship problems, trauma, and they continue to be in a way that abuse of narcotics is seen in our community today. Psychodynamic therapies have undergone an enormous transformation in placing psychological treatment along with narcotics as the best option to treat pain and to reduce the addiction dynamic that we face in our society. From 2000 to 2014, more than 500,000 people overdosed on narcotics, based on a report by the CDC. The prevalence of adverse effects by drug abuse and how psychological treatment can have a positive change. The use of psychological therapy, along with narcotics, has many advantages. The problem of narcotics is evident in our community. The use of narcotic drugs come with many side effects, from constipation, allergic reactions, nausea, vomiting, all of the such. High doses of the drug have been shown to cause a stupor, confusion, convulsions, and even death. These are just but a few facts that we cannot avoid when it comes to using narcotics. One thing that stands out is a vital note that all narcotics are addictive. When we stop using drugs medically to solve health issues and achieve medical objectives in helping humanity, it is sad to see that what we intended to be a solution has turned into such a big problem. The reality is that we are not in a position to get rid of narcotics completely. Therefore, it is a need to find a solution to decrease this epidemic and thus bring psychological therapies into effect. Acupuncture, talk therapy, whirlpool, physical therapy. These are just a few of the options that we can use instead of narcotics or in conjunction with narcotics to reduce the likelihood of addiction. Using a multidisciplinary approach. Using psychological therapies along with narcotics will help greatly deal with the adverse reaction and addiction. The patient or the individual under the influence of narcotics will experience a significant reduction when the way a person or their brain receives pain is altered. If we can train our brain to see pain in a different way, we can decrease the likelihood of long-term use of narcotics. Society today is crying for our youth who wonder and agonize on drug use. The application of psychological therapy in conjunction with the use of narcotics can help prevent such addiction. Then we'll have a progressively better medical and social discipline in our community. The full inclusion of psychological therapy along with narcotics has the potential to help address and reduce drug abuse and achieve remission. The results of an assertive outreach, case management, stage-wide, and motivational approach are visible. Imagine you send your grandma into the hospital that she's broken her hip from her fall. She's recovered great and she's back up and she's walking. But you notice something different. She's not her normal self. She's always going around looking confused or sleepy or just out of wits. And it comes to find out that she's now addicted to prescribed pain medicine that she's been buying off of the street. So one day you come home and you find her laying on the ground, unconscious. She's overdosed. This is something that I want to prevent. This is something that I want to see change. Imagine your son, daughter, or mother, or any of your dear ones went in for treatment and they came out addicted. It can happen. How do you feel? It is indeed a state of pain of both victims and the family. The thought that you could have done something and you would have done something, but you didn't, is a big problem. We have to stand, we have to fight, we have to secure this issue for future generations. The knowledge is right here with us. We cannot ignore it. We cannot continue to let our community suffer. What shall we do then, I asked? Require that anyone taking narcotic medications be also required to participate in psychological therapy. We all can do something about this problem. We need to spread the word throughout our communities and society. The least we can do is voice this message and heal our community. I look forward to a community free of drug addiction. I hope that we can make this change. I hope that we can be the change that we want to see. Our people can be healthy again. We can take a proactive measure and secure our generation and for those to come. When all is said and done, the answer is right here in front of us. We know this problem has a solution. Do we sit and let our societies die and suffer, or do we rise and take a stand? One more thing, incorporating psychological therapy into the use of narcotics help reduce the duration and exposure which prevents addiction. Yes, we can do something about it. I can do something. You can do something. Thank you and God bless.